Question 1. To illustrate this point, consider a nuclear medicine program that conducts its own internal review of mission and goals every 5 years. The program director notices a disconnect between its stated mission and the evolving scope of nuclear medicine technology, particularly with the rise of theranostic applications and hybrid imaging modalities. The director wants to revise the mission to reflect the new standards but is unsure of how frequently mission reviews are expected under JRCERT guidelines. What is the most appropriate next step the director should take? A. Update the mission only when accrediting agencies request it. B. Revise the mission once the program faces non-compliance issues. C. Initiate a comprehensive review process that includes faculty, students, and clinical affiliates. D. Postpone revision until the next JRCERT site visit to maintain consistency. Answer. Correct answer. C. Explanation. JRCERT Standard 1.4 requires programs to engage in regular, systematic review of their mission and goals, ensuring they reflect current practices and advancements in the profession. The review must involve key stakeholders, including faculty, students, and clinical affiliates, to maintain relevance and alignment with community needs. Options A, B, and D reflect reactive rather than proactive strategies and fail to meet the collaborative requirement of the standard. Question 2. During the process of evaluating clinical rotation effectiveness, a student reported that one of the sites lacks diverse patient demographics and primarily focuses on routine bone scans. This has limited their exposure to advanced imaging like PECT and cardiac perfusion studies. Which of the following actions should the program coordinator prioritize? A. Reassign the student to a site offering comprehensive imaging techniques. B. Ignore the feedback as long as competencies are documented. C. Wait for annual review before addressing the issue. D. Ask the student to submit more case logs to meet diversity. Answer. Correct answer. A. Explanation. According to JRCERT Standard 3.3, clinical sites must provide diverse patient populations and exposure to a variety of procedures. Option A ensures compliance by addressing the immediate limitation. Option B disregards educational quality, and C delays action, violating the standard. Option D focuses on quantity, not quality, or diversity, failing to meet the educational objectives. Question 3. In contrast to traditional image processing where manual steps were emphasized, a modern nuclear medicine program has introduced automated reconstruction and AI-assisted analysis. A faculty member refuses to teach the new system, insisting on legacy methods. What is the most appropriate action for the program director? A. Remove the faculty member immediately. B. Provide targeted professional development in emerging technologies. C. Assign another faculty member while ignoring the conflict. D. Disregard the concern as both methods are valid. Answer. Correct answer. B. Explanation. Per JRCERT Standard 1.9, faculty must engage in ongoing professional development to stay current with technological advancements. Option B aligns with this standard and encourages growth. Removing the faculty A is too drastic without remedial opportunity. Option C does not address root issues, and D ignores the responsibility of staying current in instruction. Question 4. Based on the information, Mr. Alvarez, a nuclear medicine technologist student, is required to handle and prepare radiopharmaceuticals as part of his clinical competencies. He accidentally contaminates a syringe and disposes of it in a regular biohazard container. What should his supervising technologist do in response? A. Report the incident as a near miss and retrain the student. B. Reprimand Mr. Alvarez without documentation. C. Ignore the issue since it didn't harm anyone. D. Complete the procedure on his behalf to save time. Answer. Correct answer. A. Explanation. This situation involves radiation safety and proper waste disposal as outlined in JRCERT Standard 5.2 and NRC regulations. Reporting. A near miss promotes a safety culture and allows retraining without penalizing learning. Options B, C, and D reflect negligent behaviors and violate institutional safety protocols and legal responsibilities regarding radioactive materials. Question 5. The core principles of medical ethics are crucial in nuclear medicine training. Which of the following best reflects adherence to ethical principles in a student's clinical education? A. Documenting procedures even if the patient did not consent. B. Refusing to perform scan without verifying the written order. C. Performing scans on friends for practice purposes. D. Discussing patient details with classmates to learn more. Answer. Correct answer, B. Explanation. JRCERT Standard 5.3 emphasizes ethical conduct and patient rights. Option B upholds non-maleficence and autonomy by ensuring proper authorization. The other options breach patient confidentiality, consent laws, or ethical practice, all of which are strictly regulated under HIPAA and professional conduct standards. Question 6. Through the lens of continuous quality improvement, a nuclear medicine program identifies that a high percentage of students are underperforming on the image processing section of their final evaluation. What should the program faculty do first? Increase the number of assessments without changing teaching. B. Review course objectives, teaching methods, and student feedback. C. Eliminate image processing from the curriculum. D. Make the exams easier to improve pass rates. Answer. Correct answer, B. Explanation. Under GRCERT Standard 6.1, a program must employ systematic program evaluation to identify and address learning gaps. Option B ensures data-driven curriculum improvement. Options A, C, and D do not address the underlying issue and fail to meet evidence-based educational practices. Question 7. In light of recent developments, Ms. Patel is a faculty member in a nuclear medicine program and has recently received a certification in theranostics. How should the program most effectively utilize her new qualification? A. Assign her to lead curriculum updates in theranostic instruction. B. Ask her to shadow current clinical instructors. C. Have her write an article for the program newsletter only. D. Exclude her from teaching to prevent redundancy. Answer. Correct answer, A. Explanation. JRCERT Standard 1.9 promotes leveraging faculty expertise for curriculum enhancement. With the rapid expansion of theranostics, it is vital to integrate emerging practices into education. Option A aligns faculty qualifications with instructional content. Options B and C are underutilizations, and D contradict JRCERT's intent. Question 8. Among the various student complaints submitted over the semester, several mentioned inconsistent feedback and unclear grading in clinical rotations. What strategy should the program employ to address this issue? A. Develop a standardized evaluation rubric used across all clinical sites. B. Ignore it if the majority of students pass. C. Ask each preceptor to use their own method. D. Shorten the clinical rotation to reduce evaluation time. Answer. Correct answer, A. Explanation. JRCERT Standard 4.4 mandates fair and consistent assessment of student performance. A standardized rubric ensures transparency, objectivity, and fairness across all sites. Options B, C, and D compromise quality and fairness and risk non-compliance with accreditation expectations. Question 9. From a practical standpoint, what is the primary advantage of having a qualified clinical preceptor for each rotation site? A. They reduce the need for program faculty involvement. B. They ensure students receive consistent, supervised instruction. C. They are less expensive than hiring faculty. D. They replace the need for academic evaluations. Answer. Correct answer, B. Explanation. JRCERT Standard 1.8 emphasizes that qualified clinical preceptors are essential for effective supervision and education. They bridge academic instruction with clinical application. Option B aligns directly with the intent of this requirement. Options A, C, and D misrepresent the preceptor's role. Question 10. Considering the evidence, a program received feedback from employers noting that graduates lacked proficiency in hybrid imaging interpretation. What action should the program prioritize? A. Add a didactic course and hands-on practice focusing on hybrid modalities. B. Inform employers that interpretation is not a program focus. C. Encourage students to self-study hybrid imaging. D. Extend program duration by 1 year. Answer. Correct answer. A. Explanation. To comply with JRCERT Standards 4.1 and 6.3, programs must use feedback for continuous improvement and ensure alignment with current industry demands. Adding targeted instruction in hybrid imaging demonstrates responsiveness and commitment to student competency. Other options ignore stakeholder input or impose unnecessary burdens. Question 11. In a context of nuclear medicine technology education, the integration of didactic instruction with clinical experiences is critical. Given the circumstances, what is the most important factor when determining the balance between classroom and clinical training? A. The availability of clinical preceptors for supervision. B. The specific goals outlined in the program's mission statement. C. The assessment of the student's academic knowledge prior to clinical exposure. D. The number of students enrolled in the program. Answer. Correct answer. C. Explanation. The integration of didactic instruction with clinical experiences should be based on a systematic evaluation of student academic knowledge. Ensuring that students are well prepared before entering clinical environments is essential for effective learning and safe practice. According to GRCERT standards, this preparation involves clearly defined learning objectives for both didactic and clinical phases of the program. Availability of clinical preceptors, though important, does not supersede the need for academic readiness before clinical training. Question 12. The quality control and quality assurance methodologies are critical components of any nuclear medicine program. What is the primary reason for the systematic implementation of these practices? A. To ensure that equipment is operational and safe for use in clinical settings. B. To reduce the cost of maintaining radiation safety equipment. C. To meet specific legal and ethical obligations for radiation exposure limits. D. To standardize procedures across all clinical education sites. Answer. Correct answer. A. Explanation. The primary reason for quality control and quality assurance practices is to ensure that all equipment is operational and safe for clinical use. This practice aligns with JRCERT accreditation standards, which emphasize the need for proper maintenance and calibration of equipment to ensure both patient safety and the safety of nuclear medicine technologists. While legal and ethical concerns are essential, the main of these practices is operational safety. Question 13. Given the circumstances of a nuclear medicine program review, how can faculty development be most effectively supported? A. By increasing the number of faculty hired each year. B. Through regular opportunities for professional development and continuing education. C. By reducing the workload of faculty to increase available training time. D. By allowing faculty to self-assess their teaching effectiveness. Answer. Correct answer. B. Explanation. The most effective way to support faculty development is through regular opportunities for professional development and continuing education. According to JRCERT standards, faculty members must remain current in their field to provide the highest quality education. This can be achieved through workshops, certifications, and other professional development initiatives. Simply increasing faculty numbers or reducing work does not guarantee enhanced faculty competence. Question 14. During the process of accreditation, what is the role of systematic evaluation of student learning outcomes? A. It serves as a basis for adjusting the curriculum and improving program effectiveness. B. It is used primarily for measuring individual student performance in clinical settings. C. It ensures that all students achieve the same score on written exams. D. It serves to evaluate the effectiveness of the teaching methods used by faculty members. Answer. Correct answer A. Explanation. The systematic evaluation of student learning outcomes is a key mechanism for adjusting the curriculum and improving program effectiveness. JRCERT accreditation emphasizes continuous improvement based on data collected from evaluations. These outcomes provide insight into how well students are mastering key competencies and can guide the revision of the program's curriculum to address any identified gaps. Question 15. Which of the following statements best describes the significance of patient care and communication skills in A nuclear medicine technology program. A. They are secondary skills that only become relevant in clinical settings. B. They are essential skills that are emphasized both in didactic instruction and clinical practice. C. They are necessary only for students planning to work in a hospital setting. D. They are evaluated primarily through written exams and quizzes. Answer. Correct answer. B. Explanation. Patient care and communication skills are essential components of both didactic instruction and clinical practice in nuclear medicine technology. JR-CERT accreditation guidelines emphasize that nuclear medicine technologists must possess these skills to effectively interact with patients, ensuring a positive patient experience and enhancing clinical outcomes. These skills are evaluated through clinical performance, not written exams. Question 16. Which of the following is the most significant aspect when selecting clinical education sites for nuclear medicine programs? A. The clinical site's ability to host large number of students simultaneously. B. The diversity of patient populations available for clinical education. C. The proximity of the clinical site to the program's main campus. D. The amount of financial compensation provided to clinical preceptors. Answer. Correct answer. B. Explanation. The diversity of patient populations is a crucial factor in selecting clinical education sites. JR-CERT standards require that clinical sites provide a variety of patient experiences to ensure that students are exposed to a wide range of clinical scenarios. This diversity in patient population enhances students' learning and prepares them for the variety of cases they will encounter in professional practice. Question 17. When analyzing the effectiveness of a nuclear medicine technology program, what is the primary source of data used to measure program outcomes? A. Faculty evaluations from clinical preceptors. B. Feedback from students about the program's administrative processes. C. Systematic assessment of student learning outcomes. D. Survey data from graduates on job satisfaction. Answer. Correct answer. C. Explanation. The primary source of data used to measure program outcomes is the systematic assessment of student learning outcomes. According to JR-CERT accreditation standards, continuous evaluation of student performance ensures that the program is meeting its goals and preparing students for the workforce. Feedback from clinical preceptors and graduates is useful but not the central form of evaluation. Question 18. What is the primary reason for defining SMART program goals in nuclear medicine education? A. To ensure compliance with regulatory requirements. B. To track student attendance and participation in clinical rotations. C. To guide the program's development and assess its progress over time. D. To facilitate faculty recruitment and retention. Answer. Correct answer. C. Explanation. SMART program goals: specific, measurable, achievable, relevant, time-bound, are designed to guide the program's development and assess its progress over time. JR-CERT accreditation emphasizes that well-defined program goals allow for clear direction and accountability. They also provide measurable benchmarks to determine the program's effectiveness and areas for improvement. Question 19. To ensure the quality of clinical education, how should a nuclear medicine program evaluate its clinical preceptors? A. By having students complete satisfaction surveys about their preceptors. B. By monitoring the preceptors' teaching effectiveness through direct observation and feedback. C. By reviewing the clinical preceptors' academic credentials and certifications. D. By comparing preceptors' performance to national averages in clinical evaluations. Answer. Correct answer. B. Explanation. The most effective method for evaluating clinical preceptors is through monitoring their teaching effectiveness via direct observation and feedback from students. JR-CERT standards stress the importance of continuous assessment to ensure that preceptors are providing quality instruction and supervision. Satisfaction surveys alone do not provide sufficient data on preceptors' teaching abilities. Question 20. What is the primary purpose of a nuclear medicine technology program's mission statement? A. To outline the program's strategies for marketing and recruitment. B. To provide clear framework for the program's educational goals and values. C. To list the legal regulations the program must comply with. D. To define the financial resources allocated to the program. Answer. Correct answer. B. Explanation. The primary purpose of a nuclear medicine technology program's mission statement is to provide a clear framework for the program's educational goals and values. This aligns with JR Cert accreditation standards, which require that the mission statement reflect the program's goals and the outcomes it aims to achieve. The mission statement helps guide the development of the curriculum, student learning objectives, and overall program structure. Question 21. In nuclear medicine, which of the following best describes the process of radiopharmaceutical preparation for clinical use? A. The radiopharmaceuticals are prepared only in a clean room to maintain sterility. B. Radiopharmaceuticals must be prepared by licensed radiopharmacists and tested for radiation safety. C. The preparation process involves mixing chemicals that are then irradiated to produce the radioisotope. D. Radiopharmaceuticals are prepared on site only when ordered by a physician. Answer. Correct answer. B. Explanation. Radiopharmaceuticals must be prepared by licensed radiopharmacists who ensure they meet all radiation safety requirements, including proper handling and dosage. Quality control and testing are critical to ensure safety and effectiveness. Question 22. In the context of clinical education in nuclear medicine, what is the primary responsibility of a clinical preceptor? A. To teach students about radiation protection protocols in the classroom. B. To monitor student progress and provide immediate feedback during clinical rotations. C. To prepare all the clinical documentation and patient records. D. To ensure that students are always supervised by a licensed radiologist. Answer. Correct answer. B. Explanation. The primary responsibility of a clinical preceptor is to monitor student progress and provide real-time feedback during clinical rotations. Preceptors are responsible for ensuring students develop hands-on skills and meet clinical competencies. Question 23. When implementing new technology in a nuclear medicine program, what is the most critical step in ensuring its successful integration into the curriculum? A. Conducting a cost-benefit analysis to determine its financial viability. B. Training faculty on how to operate the new technology before student use. C. Updating the curriculum to include the new technology as part of the student learning outcomes. D. Testing the technology with a small group of students before full-scale use. Answer. Correct answer. C. Explanation. Updating the curriculum to integrate new technology is the most important step. This ensures that students are trained on the latest equipment and that the program remains current with technological advancements in the field. Faculty training and technology testing follow this update. Question 24. What is the most effective method to ensure that students in a nuclear medicine program are developing strong clinical decision-making skills? A. By providing a series of case studies for students to analyze and solve. B. By incorporating role-playing scenarios in which students make clinical decisions. C. By giving students direct access to all patient records for self-directed learning. D. By involving students in diagnostic discussions led by faculty during patient evaluations. Answer. Correct answer. A. Explanation. Providing a series of case studies is the most effective method to develop strong clinical decision-making skills. Case studies allow students to analyze real-world scenarios, apply their knowledge, and make informed decisions. Role-playing and faculty-led discussions are also valuable but secondary. Question 25. What is the purpose of the clinical competency checklist in nuclear medicine education? A. To assess whether students meet national certification requirements. B. To ensure that students are practicing safe patient care techniques. C. To provide a structured method for evaluating and documenting student progress in the clinical setting. D. To track the number of clinical hours each student has completed. Answer. Correct answer. C. Explanation. The primary purpose of the clinical competency checklist is to provide a structured method for evaluating and documenting student progress in clinical settings. It ensures that students meet the required competencies to progress in the program. Question 26. Which of the following is most important when selecting a clinical site for a nuclear medicine program? A. The availability of on-site faculty members to teach students during rotations. B. The presence of advanced imaging technologies and equipment. C. The site's history of successful student outcomes and positive feedback. D. The proximity of the site to the program's main campus for easier transportation. Answer. Correct answer. C. Explanation. The most important factor is the site's history of successful student outcomes and positive feedback. This ensures that the site provides high-quality training and fosters productive learning environment for students. Question 27. In nuclear medicine technology, what is the primary purpose of radiation protection protocols? A. To prevent the contamination of nuclear medicine rooms. B. To ensure the safety of patients, staff, and students by minimizing radiation exposure. C. To comply with legal regulations regarding radiation usage. D. To limit the amount of radioactive waste produced in the facility. Answer. Correct answer. B. Explanation. The primary purpose of radiation protection protocols is to ensure the safety of patients, staff, and students by minimizing radiation exposure. While legal compliance is necessary, the core goal is to maintain a safe environment for all individuals involved. Question 20. What should be the first step when developing a new clinical education site for a nuclear medicine program? A. Ensuring the site has sufficient patient load to provide enough training opportunities. B. Ensuring the site has the necessary medical imaging equipment and technology. C. Establishing a relationship with the site's clinical preceptors to ensure teaching capabilities. D. Ensuring the site has passed accreditation and meets all regulatory requirements. Answer. Correct answer. D. Explanation. Ensuring the clinical site is accredited and meets regulatory requirements is the first step. Accreditation guarantees that the site adheres to the necessary standards for patient care and educational quality, which is critical for student training. Question 29. Which of the following is the most effective method for ensuring that students meet clinical learning objectives in nuclear medicine? A. Assigning students to a wide variety of clinical tasks without regard to their competencies. B. Allowing students to rotate through different departments regardless of their progress in each area. C. Regularly assessing student progress through formative and summative evaluations with clear feedback. D. Having students work independently without oversight in clinical settings. Answer. Correct answer. C. Explanation. The most effective method is regularly assessing student progress through formative and summative evaluations. This approach ensures students meet clinical learning objectives while also providing them with actionable feedback to improve their skills. Question 30. What is the role of research in a nuclear medicine technology program? A. To allow students to focus primarily on academic knowledge rather than clinical practice. B. To ensure that students engage in cutting-edge advancements in nuclear medicine. C. To give faculty an opportunity to publish papers and raise the program's profile. D. To measure the success of the program in terms of job placement rates after graduation. Answer. Correct answer. B. Explanation. The role of research is to ensure that students engage in cutting-edge advancements in nuclear medicine. Research enhances the educational experience by exposing students to the latest developments and encouraging them to critically evaluate emerging technologies and methods in the field.